5.5 hours. That's how long the average emergency room visit takes in Massachusetts, and it's the second longest in the country.
Numbers you don't want to hear around here for sure. Investigative reporter Ted Daniel has been looking at what patients are supposed to do when faced with those long waits and what's being done about it. As he explains, the advice from some hospitals is go elsewhere.
With diabetes and hardened arteries, Daggett of Stoughton has spent a lot of time in the hospital, but he says he's never had a wait like this.
It was 16 hours?
I was there longer. Okay, this is at the point where I wanted to leave. It just didn't have the people.
Danny says he was at Steward-owned Good Samaritan Hospital in Brockton for an emergency blood transfusion scheduled by his primary care doctor.
And we kept going up to ask, you know, when we're going to be seen, when we're going to be seen. They couldn't answer us.
25 Investigates found Good Samaritan, South Shore in Weymouth, Boston Medical Center, Mass General, and UMass Memorial in Worcester are among the many Massachusetts hospitals where ER visit times exceed the national median. And the average length of stay grew from 4.2 hours in 2018 to 5.8 hours in 2022. Hospitals blame sicker patients, staffing shortages, mental health emergencies, and a lack of beds at facilities that treat people after they are discharged.
And do we know the source?
Left pneumonia.
Dr. Matthew Mustafi is the Associate Chair of Emergency Medicine at Tufts in Boston. He says people with trauma, chest pain, paralysis, internal bleeding, and other critical conditions need the resources and specialists an ER provides. At Tufts, 1 out of 5 visitors are admitted to a hospital bed, but up to 30% receive minimal testing and treatment and go home.
If you come to an ER and you don't have a life-threatening emergency, that's okay. We will take care of you. You know, the downside of that, it just comes at a cost.
That cost is in time and money. With insurance, a typical ER copay starts about $150. Without insurance, the average bill is $2,600. Baseline insurance copays for primary or urgent care clinics typically run between $25 and $75.
Every individual should have an identifiable primary care physician.
Barbara Spivak is a primary care doctor in Watertown and the current president of the Mass Medical Society. She knows finding a primary care doc can be difficult because of the nationwide shortage, but for things like the common cold, sprains, cuts, and bruises, that should be your first call.
There are also intermediate places of urgent care and walk-in centers that for people who are not sure and who are at low risk, that they can go there.
There has been a surge of ER alternatives nationwide, and you can identify the ones closest to you now before you need them. We found 3 urgent cares and a pharmacy clinic within a mile of our Dedham studio.
Had you ever had an experience like that before?
Oh, no, no.
25 Investigates wanted to know what hospitals are doing to get those wait times down for patients like Danny Daggett. The Massachusetts Health and Hospital Association wouldn't talk to us on camera, saying in a statement they are working around the clock to meet the needs of patients and to advocate for solutions in partnership with elected leaders.
You can tell they were kind of frustrated, but no, nobody apologized.
Hospitals are required by law to treat patients regardless of their ability to pay. That's another reason people end up in the ER. Urgent cares and walk-ins often require payment at the time of service. Dr. Spivak tells me the longer you wait to get care, that will only increase the chance of it turning into an emergency. For 25 Investigates, I'm Ted Daniel.